Welcome to the Physician Associate Podcast.
Hello, welcome to this episode of the Physician Associate Podcast. My name is James. Today I'm joined by Chloe Denyer, who's a Physician Associate in Liaison Psychiatry. Welcome to the show, Chloe.
Hiya, I'm Chloe. I've been working in liaison psychiatry for sort of around 10 months now, and it's a really interesting subject for me. Prior to this, I worked for almost 2 years in GP, so it was a bit of a step going into liaison psychiatry, but it's been a really interesting time.
Can I ask what prompted the move from primary care into psych?
I really enjoyed mental health aspects within GP. It's a very different type of mental health within GP compared to sort of obviously the secondary services, but it really gave me quite a lot of exposure to mental health as a specialty. And I just thought, why not try something a little bit different, a bit new, and just went for it basically.
And were you going into a service in psych liaison as the first PA, or did they have PAs established already?
So they actually had one PA already established who had been there for around a year when I joined the team. And that was her first job outside of university. And so it was really nice to be in a team that already knew PAs quite well and understood the role and the things that the role can do within the service itself.
There are all sorts of different subspecialties within psych itself, aren't there? Where does psych liaison fit into the bigger picture of psychiatry?
So there's lots of different specialties within mental health services. So we have sort of the inpatient wards, which would be split between sort of adult and paediatric wards. And then you have sort of the older adult services within that, separate to some of the working age inpatient services. There's a lot of community services. So you have the more specialty services, which would be things such as the perinatal teams, the eating disorder services. And then you have the general community teams, which would usually cover either the working age or some of the older adult services as well. So liaison psychiatry sits under sort of specialty services. So it basically means that we work within sort of the general hospital where patients may present to A&E with mental health problems, but also within the wards themselves. So the general physical health wards for any patient who's presenting or has concerns in regards to a mental health diagnosis or a mental health illness, we will go and review those patients. And so it's a really interesting area. We get to see a lot of people from all different specialties.
I've done lots of referrals because I work in acute medicine. We often interface with our psych liaison colleagues. And it's really nice to understand a little bit more about how it fits in for you. So are there presentations that you see quite commonly and quite frequently in psych liaison? What are the things you sort of see day to day?
Within psych liaison, I work over both the working age, so that is anything from sort of 16 to 65, and then also in the older adults, so 65 and above. So obviously you get varying sort of presentations within those two specialties. So particularly with the older adults, it may be patients who have a diagnosis of dementia, but it could be kind of challenging behaviours within dementia. Sometimes we see patients with sort of psychosis or unusual delirium presentations within the older adults. And then with the working age, we frequently will get sort of presentations, particularly to ED, in regards to self-harm, overdoses, obviously a number of presentations for sort of perinatal eating disorders as well as sort of psychotic presentations as well. So it is a real variety, but I would say, those are the significant ones that we tend to get quite regularly.
So you really are sort of at the coalface, at the sharp end of acute presentations, people in crisis sometimes. Yeah,
we really see sort of that real kind of high end stuff really. So it's really interesting and like I said, for the whole variety of psychiatry. So it means that you're not just kind of specialising in one specific area of psychiatry itself. It's sort of this very sort of acute but variety within psychiatry, which is for me what makes it really, really interesting.
Absolutely, yeah. I can imagine no 2 days are the same, perhaps even no 2 hours are the same. It must also be quite challenging at times, is that fair to say, or quite difficult?
Yeah, I think it can challenge you definitely I think sometimes some of the cases that we get involved in can deal with quite sort of difficult safeguarding concerns, or sometimes about capacity assessments and people's, decision making, and that can be really quite interesting, but also challenging to sort of decipher, for that patient and understand sort of the family's concerns, looking at the bigger picture. The other thing that can be sort of challenging, I would say, could be sort of the management of difficult patients particularly as well, and also supporting the ward. So it's not just often with one single patient, it's not just dealing with that patient and what they've come in with, it's the big picture, so the family, the ward itself, and the discharge and the next steps for that specific patient, to make sure the safety of the patient themselves is sort of prioritised, but also the whole picture from the ward safety and everybody else's safety as well, and ensuring that nothing really gets missed as much as we can. Of
course, absolutely. I hadn't appreciated that amongst or around the patients that you're seeing is the toll it's taking on their loved ones around them as well. It's a much broader picture, isn't it? Which I suppose is true of physical health as well, but often felt more sharply, I suppose, with mental health problems. As a physician associate, obviously we're all generalist and we all have a general medical training. Are you purely looking after your patient's mental well-being, or do you get involved in the physical health stuff as well as a PA? Yeah, so that's another thing I really like as a PA within liaison psychiatry, is we are looking as well at the physical health concerns for any of our patients. I say particularly the older adult patients as well. Often patients who may be presented with confusion. Obviously, we're thinking about things like delirium, and it's the things that could be contributing to those kind of patients. But also for patients presented with eating disorders, we're again looking at the physical health needs there. So ensuring that we're checking sort of the ECGs, the QTC interval within ECGs, their blood tests, making sure that things are within the parameters. So there is a lot of sort of physical health involved, I would say, within sort of liaison, which for me is really, really important to ensure I keep up that sort of generalist knowledge. So yeah, it's quite broad in that way as well. So we start off the day by doing sort of a ward round just within the office, within the team, go through all the patients on our list. So as I say, going through all sort of the older adult and the working age patients. This can take some time, obviously dependent on the number of people we have on the caseload, and from that we'll sort of decide what jobs are needed. But then also during the day we will have sort of multiple referrals that come in, and then we sort of just allocate those as it comes through during the day. So any day is different to the next, basically. So it can be really, really varied. I may have sort of, a number of new patient assessments, or it could be a majority of sort of reviews. It can also consist of doing sort of cognitive assessments. We have a psychologist that also works in our team, and sometimes do some sort of therapy-based work with her support. Can be really useful as well for the patients while they are in hospital too. So it can be a whole variety of different things that we're able to do, which is really exciting. The other thing I've been able to do a little bit of my week at the moment is just giving some mental health training to some of the wards. So just for a couple of hours, one morning a week, doing some training just to ensure that they feel sort of supported, and that we can sort of pick up on any concerns that they may have with some of our mental health patients within the hospital too. Oh, that sounds brilliant. Excellent. A bit of outreach. Fantastic. Is there anything that you had to learn, especially to do your job, that you didn't have the skills of coming through PA school? We all learn how to listen to our hearts and chests and those kind of things, but was there anything specific as you started in psych that you either had to revise, or new skills that you've learned that are tailored to psych? I would say some of the medication particularly, we didn't really have any knowledge or very little knowledge of sort of some of the more kind of developed medications that are around in regards to psychiatry. And I think also sort of some of the diagnoses as well. I think from my opinion, I think when I was in PA school, the teaching that we had on mental health was quite limited, but I had a fantastic mental health placement, really, really good. And I got to see sort of ECT. I got to go with the home treatment team. So I was able to see quite a variety of different things at that point. But I'd say the medication side of things is something that I probably had to learn, particularly sort of the depots, injections and things like that. Right at the beginning was a big one for me. I think also probably some of the Mental Health Act, sort of the section 2, section 3, section 136, all of these sort of things were sort of very new to me at the beginning. And I'm still sort of trying to get my head around all the different types of sections at the moment, which to a lot of the mental health nurses who I work with is sort of, rolls off the tongue. They know instantly what those things mean. So I'm still sort of learning aspects of the job, I would say. But I think because
we are based in the general hospital, it's quite nice because I feel sort of majority of the things I am able to sort of really help and support the team with, and I feel that I can sort of manage as well. So, but we're in a really sort of supportive team environment. It helps to, even if there are things that I pick up that maybe I need to learn or that I feel that I probably am a bit more rusty on than the others, then it's an opportunity to do so.
How have you landed as a physician associate? What's been the response of the sort of team around you?
Yes, it's been a really positive response. It's a really good team to work in, multidisciplinary team, and a very supportive environment too. So we work with 2 consultants full-time, one within older adults, one within working age, and then another part-time working age consultant as well. And then a large number of nurses, a clinical psychologist, as well as an occupational therapist as well. So it's a really supportive multidisciplinary team. Everybody's very supportive. They're sort of understanding of what the PA role is, and they understand sort of some of the training that we may have not had, for example, as I mentioned before, in regards to sort of the different types of sections, but they understand also the medical knowledge. And I think one way that we can help support them is sometimes the medical knowledge. The mental health nurses do struggle sometimes with some of the medical knowledge that they've mentioned to me. So we sort of can work together and we can sort of help each other out on where maybe either one has less knowledge in, which is quite nice to be in that sort of supportive environment where you're able to do that. And the other thing is we can also do sometimes dual assessments. So with the mental health nurse, we may go together to do an assessment together to sort of help support and manage the patient as best we can too. So it's quite a nice opportunity to work in that sort of environment.
Yeah, that sounds great. Like you complement each other's skills. It blends really well, I imagine. And from the junior doctor's point of view, it must, when they're rotating all the time to get experience, it must be nice for you to be in post as that point of continuity.
Yeah, definitely. It's really nice. We can sort of, the first couple of weeks, sort of take them under our wing, just helping them with, because there's a lot of different admin things and bits and bobs that we have to do, unfortunately, to sign off all different systems. So it's quite nice to be able to show them sort of the different things that what we do as a team and sort of the working within the team. And they're able to get kind of confident within just a couple of weeks and be able to do all the things by themselves after that time. So it's really nice, kind of close working with all the different members of the team to be able to do that, really.
I must say, I'm really impressed with the Royal College of Psychiatry. Have put an awful lot of effort into establishing the role of PAs in psychiatry, and lots of support documents and resources on their website and webinars. And they're really engaged in making PAs successful in psychiatry. It's nice to hear that support is there for you as well in your team.
Yeah, definitely. I think it's a really exciting time for any PA who wants to join psychiatry at the moment. I think there's going to be so many more opportunities within sort of the jobs themselves, but also within sort of the Royal College of Psychiatrists. I think they've got a lot of things planned. Working in psychiatry can be challenging, and it is an area which can be challenging. And I think I talk to other people in different specialties, for example, sort of A&E, and some of them say, "Oh, I could not work in psychiatry." It's, and I think it can be really difficult for some people, but for other people, it's a real area where actually you can really help and you can really do things which are really positive for patients. And I think for myself, although it can be challenging at times, for me it's a challenge that I enjoy, and it's a challenge that I'm able to sort of overcome and use sort of my skills and my feeling towards sort of psychiatry to help those patients who are in need. Yeah,
I imagine there are some really challenging days and also some really rewarding moments as well. So for anybody who's listening to this who might be considering employing a physician associate into their psychiatry service, if they're writing a job description, what do you think makes an attractive job advert and a good job for a PA in psych? Yeah,
so I think for any PA job advert, whether it's within psychiatry or not, it's about making sure that the people who are offering the job knows what PAs are and knows what the role is itself and what the role entails. And there are sometimes jobs which pop up which sometimes aren't aware of those things, but I can say a number of jobs really now do kind of understand what the role of the PA is. But I think that's really important for your own, especially if you are a new PA, for your own sort of support and your knowledge and your growth within sort of the PA role. That's really, really important. In regards to sort of PAs within psych specifically, I think that particularly if you're going into more of a specialty area within psychiatry, for example, sort of the eating disorder services or perinatal services, it's ensuring that that there is like good support there. So especially in regards to sort of possible teaching opportunities, so that you're able to sort of get that continuous support. PAs don't have a significant amount of teaching within sort of those specialty areas, and ensuring that teaching is available for those new PAs or PAs new to that specific role is really important, so that they feel supported and are aware of sort of the different sort of specialty. That specialty knowledge is really, really important. I think also sort of a good support service from a mental health point of view and a wellbeing point of view, rather than just the teaching side of things, is really important. So as I said, within my team, we've got a really good supportive sort of team environment where you feel very well supported by the other members of the team. But we also have sort of regular check-ins, so regular check-ins with my supervisor, which means I feel sort of very well supported in regards to my own sort of well-being. And if I sort of had any concerns or issues in regards to maybe a specific patient that kind of concerned me, or any concerns from any other points, or particularly in regards to sort of areas which I feel that I'm struggling with, then I've got a really good opportunity to be able to reach out to my supervisor, but also to the members of the team as well for further support. So I think support is really, really important in many different ways for a new PA specifically.
Okay, brilliant. So for anybody who's thinking about coming into psychiatry, perhaps as a student, or if they're thinking newly qualified and picking up their first job, are there any resources that you found useful in your first few months to learn from?
Yeah, definitely. So the Royal College of Psychiatrists have loads of information on their website, lots of documents in regards to different sort of textbooks and papers that can be really interesting and can be really good for a good read. There's lots of webinars available as well through the Royal College of Psychiatrists, but also through other services such as the Maudsley have some really good webinars and services which are available, which can be really useful. Yeah, I think that's probably particularly those things I've really used. But the Royal College of Psychiatrists website has just so much information on, and so many talks and different things. So I'd really sort of flag people to that website, really. So I think one of the big things that...
So I guess one of the concerns, or perhaps the worries that people have about going into any specialty, is it could be difficult to sit the recertification exam and you may lose some of your generous knowledge. It sounds like in psych liaison you do quite a lot of general physical health anyway. Have you found that difficult to keep up your knowledge?
Yeah, so I think within liaison psychiatry, it's a really kind of golden opportunity to keep up that generalist knowledge. You've got a wide exposure, as I said, to different patients of all different ages, and often they can come in with sort of physical health concerns, particularly our patients who are on the wards, and can be there for a number of weeks, and we are sort of balancing their sort of physical concerns and their mental health concerns. But for different areas of psychiatry, I think other people do have worries about sort of going into mental health and going in very specifically to that specific area and losing some of that generalist knowledge, just as you said. And I think one of the things that's important is, you know, mental health and physical health do come in turn, and often people with sort of mental health problems do have physical health concerns. And for example, working in sort of eating disorder services, a lot of it is sort of physical health based, and there is also a lot of physical health work going on with some of the community teams at the moment as well for patients who may be on sort of certain antipsychotics, and that sort of thing. It's really important to look at their physical health needs as well as their mental health needs. So I think it's not just about sort of the mental health when you go into mental health and psychiatry itself. It's going to be about, like I said, that bigger picture, looking at the whole person, not just the symptom they're coming in with. So I think it's a really golden opportunity to be able to have that exposure to different mental health needs and illnesses, but also different physical health needs, and maybe how those sort of two intertwine.
That makes a lot of sense. I think that's a really good point you've made. So obviously with the pandemic that we've all gone through over the last 18 months, 2 years, what impact has COVID had in your role and on psychiatry and mental health in general in your experience?
Yeah, so I think a lot of services have seen sort of increase in demand, particularly within sort of mental health services. So I think there are a variety of different reasons for this. I think particularly at the beginning when the pandemic hit, some of the community services were not seeing consistently a lot of their patients face-to-face. It was more sort of over the telephone, similar to sort of GP services as well. And I think the difficulty is obviously with particularly mental health, and sometimes being over the phone, we're not able to get sort of maybe the full picture with some mental health concerns, and there is a potential risk of patients maybe relapsing, which may have been mitigated somewhat by face-to-face appointments. The other thing is obviously it's been a really distressing time over the last sort of 18 months or so, and people may have had multiple bereavements if it's affected specific families, but there's also been a number of job losses and financial concerns, and all of these are really big stresses in regards to people's mental health, and it can be it's a really difficult time. The other thing is this is almost like a sort of trauma that we're all experiencing at the same time. We've had a complete change to our lives, and things have really changed for all of us. And I think all of us need to ensure that we sort of look after each other's sort of well-being, ensuring that we're sort of checking in people, because this is a time which is different to any other, really. And I think because of that, we've had increased presentations, all in relation to this sort of experience of trauma that we're all experiencing. So it's really, really important to sort of check in with others, check in with family members and friends, just to make sure that everyone is sort of doing okay. And if there are any mental health concerns, ensuring that there's support for them out there.
Oh, absolutely. Really well put. And I imagine the after effects of the pandemic might be felt for years to come, especially in services like yours. What do you think the future holds for mental health services in general, and for you personally, your progression as a physician associate?
Some of the plans within the government for the NHS, I think the 5-year plan in regards to mental health is increased funding for mental health services, which is a really good opportunity if there is going to be an increased demand in service users to those services. It's really important to have that. I think there could be a potentially maybe a shift in some of the presentations. So as we all know, I think there's been a sort of quite a significant increase in the number of presentations of children. So through the child and adolescent mental health services have seen a real increased demand. And I think that's something that, we've already noticed already. And I think this could be something that could be increasing in the future with all the sort of drastic changes that a lot of children and adolescents have experienced during the pandemic, and, could potentially go on to experience for a number of years, potentially. On the point in regards to sort of progression as a PA, within mental health services and within psychiatry, I think it's a really exciting time to join. So the Royal College of Psychiatrists are doing sort of a lot in regards to physician associates at the moment. So I think it's a really exciting time with sort of the prospects of what that may have in the future. I think it's just an exciting time to be a PA anyway at the moment. Within the future potential regulation under the GMC. But I think for myself as a physician associate, what I'm sort of looking at is sort of developing my role within the area that I work in at the moment. I'm looking at doing some further teaching opportunities, and I'm also looking at potentially doing the postgraduate diploma in geriatric medicine to help support sort of, again, my generalist knowledge. And ensuring that I can sort of support our older adults from not just a mental health, but a physical health perspective too. Yeah, it's quite exciting.
Oh, good luck. Yes, I'm sure that'll be really helpful as well. Thanks for joining me on the podcast. If people have listened to this and have questions that they'd like to ask you about physician associates in liaison psychiatry, are you happy for them to get in touch with you? Yeah, definitely. That's absolutely fine. Perfect. I'll leave your contact details in the show notes below. Thanks, James. And thanks to you for listening as well. I hope that podcast was really interesting to find out a little bit more about how physician associates work in psychiatry services. And if you'd like to get in contact with the Physician Associate Podcast, we're on social media as well at PA Podcast UK, Facebook, Twitter and Instagram. Thanks for listening, and I'll see you again in the next episode.
Thanks for listening to the Physician Associate Podcast.